Tonight's special. Millions of people from all around the world decide to travel distances, if not to spend their vacations or honeymoons, to visit a doctor. A phenomenon known as medical tourism is becoming common to most countries of the developed world. Welcome back. This is Capital News Radio and I'm Stephen Mills. Let's admit it, using medical services abroad is relatively unknown territory for most of us, and there are a lot of questions to be answered. What makes healthcare in certain countries less expensive than others? Are doctors qualified to treat patients from abroad, and will they understand what I'm telling them? Joining us tonight for an interview, managing partner of a successful European medical tourism organisation called BeHealthyTravel.com, Dr. Andrew Baker. Hello, Andrew.
Hello, Stephen. Thanks for having me on the show.
Andrew, why do foreign doctors charge less than our own? Are they less qualified?
Well, our health is our greatest value, so maintaining good health is a vital investment for us.
Fair enough.
And we know it, don't we? But the thing is that organisations that provide insurance and healthcare service at home, they know this as well. And that puts them in a very powerful position to set the rules of the game.
Could you be more specific?
Yeah, sure. The healthcare system of the Western world is not as effective as it used to be. Doctors and healthcare organisations are always trying to charge insurance companies more money, while insurance companies, they're raising the premium that we have to pay. And the results that we see are soaring prices of medical services and more money to pay for health insurance. But in new European countries, the medical system has not been touched that much by the whole health insurance mechanism. And so prices remain very reasonable. Also, as you may know, in new European countries, they have to pay a lot less for utilities. For example, energy prices, electricity and so on. There they are lower. Rents are a lot smaller. A whole lot of things like that makes it possible to keep the costs down and to offer medical treatment at a very reasonable price.
You get what you pay for. Lower prices usually means lower quality and less service, right?
No, not really. Look around. We import goods from countries. They have the advantage of producing goods at less cost, but the same or higher quality.
For example?
Well, I like cars from Germany, for example, because they have a long history as great engineers. Clothes from Italy because of their cheaper labour. Fruit and vegetables from Spain. There they have a whole industry. But when it comes to medicine, it's a very complex service, and you can't bring over the doctors and nurses and the hospitals and the equipment from new European countries. So the best way to import quality medical services from abroad at a much lower price is to take our patients for treatment abroad.
Fair enough, but where do you plan to take them?
Well, to somewhere like Latvia, for example, a beautiful European country not far from Sweden. Doctors that treat our patients in Latvia, they've studied at the same medical colleges in Newcastle, in Berlin and in Philadelphia that our own doctors were trained at.
So you're implying that these doctors have more or less the same qualifications as those who work in hospitals in the UK, Germany or the States?
Exactly. They have international diplomas, years of experience and professional qualifications identical to those of our own doctors. But as I mentioned earlier, it's less expensive for a doctor in Latvia to treat you, so he or she can offer the service at a far better price.
Define better price.
Well, take a look at this comparison sheet here. Like dental implant in the UK would cost you around €2,000. But in Latvia, you can have the same procedure for just a fraction of the price, €460.
Well, that's €1,500. Quite a difference.
Yep, and look, gastric bypass surgery here, 13,500 in the UK. But look, 6,300 in Latvia. That's more than twice less expensive. And then again, hip replacement, €5,000 price difference, and so on and so on.
This is quite impressive. But what about communication? I mean, the language barrier between foreign patients and Latvian doctors.
Well, there should be, but there isn't. Doctors and nurses, they're all fluent in at least several European languages.
Including English?
Most certainly, especially English. And if you as a patient speak a specific, less commonly known language, we as a company, we help you to plan your treatment abroad. And so we allocate specialists. They speak your language, or we hire an interpreter. So there actually never is a language barrier.
OK, I'm almost convinced. Where do I begin? Will you tell me up front how much I have to pay?
Yes, it's all easier than you think. Just go to our website, www.behealthytravel.com, fill in a brief registration form, and a skilled specialist will get in touch with you shortly. You get your treatment plan, travel and accommodation options all free of charge.
Sounds good.
Well, and it is. If you need a doctor, you need it now. Get in touch with us, see how your treatment can be good for your peace of mind and kind to your family budget.
Okay, Andrew, thank you for coming on the show.
Thanks, Steve.